Hi, I'm Froggy, a radio host for one of the most widely listened to syndicated morning shows in the U.S. Being on the radio is one of my true passions. I love helping to kickstart someone's day and making them laugh along the way. I'm also a husband, a father of two, and I live every day with a rare hormonal disorder called acromegaly. Having acromegaly changed me both inside and out. Before being diagnosed and treated, my appearance changed drastically. My hands, my feet, and jaw all became enlarged. I would sweat profusely. I literally felt like I was growing out of my body, and I became depressed. There are serious health complications associated with acromegaly if it's not properly controlled. This is why I believe it is my mission to tell the world about this life-threatening disease and how to properly manage and monitor it. Watch this short animated video to learn more, and I urge you to share it with your family and friends. Awareness is key, so please spread the word. Do you or a loved one look at old photos of yourself as a teenager and notice your facial features have changed? Have you noticed an enlargement of your forehead or jaw? Has your ring or shoe size changed during your adult years? Are you often extremely fatigued? Have you had frequent headaches? Do you experience profuse sweating or a change or loss in vision? These symptoms may signal an excess of hormone in the body known as growth hormone or GH, an insulin-like growth factor 1 or IGF-1. This excess of hormones may be caused by a non-cancerous pituitary tumor at the base of the brain. The tumor secretes excess GH, which in turn can trigger an overproduction of IGF-1. This serious endocrine disorder is known as acromegaly. Acromegaly is a rare, debilitating disease that affects 115 to 295 people per million worldwide, higher than the traditional estimate of 60 people per million. When symptoms are looked at individually rather than as a whole, diagnosis can be difficult. Visible signs of the disease, including enlarged hands, feet, and facial features, evolve slowly over time. Symptoms such as fatigue, headaches, excessive sweating, and changes in vision can be overlooked as signs of aging. On average, it can take 6 to 10 years before a person is accurately diagnosed. If not controlled, acromegaly can lead to serious health complications, including high blood pressure, diabetes, arthritis, sleep disorders, colon cancer, and even death. 60% of the deaths among people with acromegaly are caused by heart disease. In fact, people with uncontrolled acromegaly have a 2 to 3 times greater risk of death than the general population. While there is no cure, acromegaly can be managed. Prompt intervention with the right treatment plan, which may include surgical removal of the tumor or medication, can increase life expectancy, prevent or reduce health complications, and improve quality of life. Blood tests are used to diagnose and monitor hormone levels in acromegaly. Even after being treated, people with acromegaly should have their GH and IGF-1 levels tested every 3 to 6 months to ensure that their disease remains under control. They should also regularly discuss how they feel with their healthcare provider, as symptoms can change, and the combination of sweating, fatigue, and headaches may signal that a disease is no longer adequately controlled and their treatment plan should be adjusted. Talk to a healthcare provider that specializes in hormonal disease known as an endocrinologist to learn more about this debilitating condition and how to best manage it. For more information and resources for people living with this disease outside the U.S., visit aboutacromegaly.com. Or in the U.S., visit acromegalyinfo.com